You've got it tuned into the Zealous Podcast. I'm your host, Rocky Snyder. This week, Tristen Asken is with me. He is Director of Rehabilitation for the NFL Chicago Bears. We're going to find out all about his role, what he's doing, and how he's keeping those Bears at a low level of injury. In the meantime, do check out Satanta College. They've got Masters of Science programs in applied sports, biomechanics, and movement science, applied sport and exercise psychology. They've got programs for performance coaching as well as sports injury and return to performance management, all at Satanta College. And you can get 10% off your tuition if you just put in the code RS10, that's RS10. In the meantime, follow us on Instagram at Rocky_Snyder. Click the subscribe button. You know how it works. And here we go. So we're going to just dive in right now and talk all about the NFL and rehab and return to play, return to performance, the whole spectrum with Tristen Asken. And because he's been with the Bears organization for quite a while, he's got his hands in every pot imaginable when it comes to rehab and recovery. And we're just going to just give you a whole fast fire bunch of questions and see what we can take out of it. But Tristen, first of all, thanks for coming on to Zealous. I appreciate your time.
No, absolutely. I appreciate it as well. Like I told you when we first met, I've been listening to you for a while now. You've had some great guests with some great content. So really, this would be a privilege on here, and hopefully I can share something that your listeners can take away and either help themselves in the future or help them out with where they are now.
Right on. Well, how about just qualifying yourself here? Give us a little background information about where you've been and how you got to the Bears, and then we're going to go right into why the NFL has fewer injuries this past season than before.
Sure. So like you said, my name is Tristen Asken. I'm born and raised in Pennsylvania. Did my undergraduate work at the University of Pittsburgh. Got a bachelor's degree in rehabilitation studies, which basically tells you should go to grad school or find something more specific to do. There's not much you can do with that, unfortunately. So I decided to go to PT school after the fact, went to the University of Miami, was there from 2012 to 2015. And then while I was at the University of Miami, I started volunteering and eventually interning in the athletic training room there. And that's essentially where I got my foot in the door from the athletic standpoint and sports physical therapy. I don't have an undergrad in athletic training or a master's in athletic training, which it's evolved into now. So my route's been a little bit different than a lot of people to get to this point. But my intern experience starting when I was a PT student really helped shape the path for me to get to where I'm at now. So when I graduated in 2015, I had a decision whether just to start working in one of the clinics at the University of Miami or do a residency program. And I decided at the time that the residency program was the way to go. And I looked at both sports and orthopedic residencies. And in talking to a lot of my mentors at the time and other people who were working in the sports world, they really emphasized finding a residency that had the experience in the world or the sports with the sports teams that I wanted to eventually get into, not necessarily worry too much about rankings and all those other things. So that really gave me a good guidance on what I should be looking at. And as a result, I ended up staying at the University of Miami, and I did an orthopedic residency instead of a sports one because the orthopedic residency and my professors and the clinicians there allowed me to continue working in the training room, which at that time there weren't a ton of sports residencies or other ortho residencies that gave that experience. You might work with some of the other Division I teams. It might be a club team. It might be an Olympic sports team, but not necessarily football. I knew that's where I wanted to be. So I decided to stay in Miami, go the orthopedic residency route, and that allowed me to continue to work during the season with the football team while I learned the didactic stuff on the side.
So, right on.
Yeah, so I finished that in 2016. And then just to kind of complete the story, I worked part-time and then full-time in the athletic training department at the University of Miami, primarily with football, but also helping out, as anyone else who has worked in college knows, with the other sports as needed. And then 2018, got a call about whether I'd have any interest in potentially moving to the NFL and working in Chicago with the Bears. And after speaking to my boss now and the athletic trainer at the time, Andre Tucker, sounded like an unbelievable opportunity. Was fortunate enough to interview, come up and meet everyone here, and then was selected for the position to be a staff PT, and have been here ever since. So like you said, I'm going on 6 years, but about to enter my 7th season once we get rolling here in April.
Fantastic. And so was football your sport of choice growing up, or what did you compete in?
I actually never played football outside of my freshman year of high school. I kicked for a year, so you can call that what you want it. But I was a soccer player. Started when I was young, played pretty competitively up through high school, and had chances to go to some smaller colleges to play if I wanted to on partial scholarships. But at that point, I decided that would have been the end, really. So if I wanted to really focus on my future, looked at schools more so for academics and what the career was going to be. So I ended up leaving football because my soccer coaches said I had to pick between one or the other because of the time commitment. But in terms of watching and being a fan, it's really always been football. I grew up a diehard NFL football fan. Always loved watching it with friends and family members. And then when I got to PT school, got in the training room, and really got around some of the players and the environment, it really solidified that that was the sport I wanted to work with.
Yeah, okay. Well, I love how you were very, how would I say it? Um, Very precise in not naming a specific team. Here you're working in the Bears organization, but I have a feeling I know what team you were rooting for.
Absolutely, yes. I'll let you make that decision. We'll keep.
And that was a good time for you to be a sports fan for that specific team. So I do believe somewhere in one of those years that you were younger, they won themselves a Super Bowl championship.
Yeah, they may or may not have. You may be right on
Yeah.
that. But people don't realize just across the board how good football is in Pennsylvania. You hear about Florida, you hear about Texas, California, Georgia. They all have great football players. But I always stand by Pennsylvania too, coming up from the youth and the peewees up through high school, and you get to see them spread out a little bit. So I try to stand behind PA as much as I can.
Now, in the state of Connecticut, there is like a Mason Dixon line between Patriots and New York Giant fans, the people that live there. So I'm wondering, you growing up out in the Pittsburgh area, does the same thing occur in your region between Steeler and Eagle fans? Or is it just, hey, if you're in Philly, you're an Eagles fan. If you're in Pittsburgh, you're a Steeler fan, and we don't talk?
Yeah, it's a good question. So like technically my hometown is from outside Harrisburg, PA, which is not quite middle of the state, a little more over towards Philly, South Central PA. So where I grew up, there are a lot of Eagles fans, and it really was the green and the white there. I don't know if
Mhm.
there really is a split line, but I'm telling you, Pittsburgh, they're diehard Steelers fans. They live and die by their team out there. But also, when I was growing up, just to throw a wrench into it, the late '90s, the Ravens came about too. So as you get into southern Pennsylvania, you're getting close to northern Maryland. So they started to gain some popularity as well. So because of the AFC North, when I was in undergrad at Pitt, most of the lines that I saw were between Steelers and Ravens fans because that rivalry was unbelievable during that time. They both were always competitive and they were so close to each other. And the games were always brutal to watch as a fan. Like you love the hard nosed football concept of it. That's what I saw more than the Eagles side of it. At least that's what I noticed.
I got you. All right. Okay. So with your residency orthopedic, then you went into the private sector for a year or two. How did working in the private sector, how did that carry over into the NFL? Do you find that you drew some good experience working in that environment and then moving into professional sports,
I
or
did.
did it have not much effect?
No, it had a profound effect, to be honest with you. I was always doing a little bit of both. I was never completely out of the training room when I entered the residency at that point, but there were times where I was much more heavily clinic based. Some of that was the residency requirement, and some of that was just helping out different times of the year. But where I worked through the hospital system, there were multiple clinics, and in these different clinics, you would see different patient populations. It was all outpatient that I worked, but you see different types of patients coming through based on the location, and then each clinic had its own equipment, some more than others. So you really had to be able to adapt to the patient that you were seeing, and then also the equipment that you had to help to treat these patients. And then also they were coming from different physicians. Different physicians at times want different things done, even if it's the same diagnosis that you're treating. So you have to really be flexible and be able to adapt at those points. But I know I tell the story to a lot of people. There was a clinic I worked at that was more or less on the bottom floor of a hospital, and it was tiny. There were a couple of dumbbells, maybe up to 10 pounds, and a leg press, and then a hybrid upper body bike and lower body bike, and that was really it. But at that point, you're expected to give the same standard of care to the patients coming into that clinic as you are to a brand new facility with all the bells and whistles. And I know as a clinician, there's going to be limitations on that. but you have to get really good at your hands, manual therapy, coming up with different exercises and limited space that can still get you to the goals that you need, because that's what the doctors and physicians will care about. And they're going to only continue to send patients to you if you're able to do that. So I think it helped me learn to do a lot without having a ton at my disposal. So now I feel like even though I'm in the NFL and I quote unquote can use anything as a resource and can really get my hands on a lot of things a lot of people can't, I still have that foundation that I don't necessarily need all of that. And I'm able to do a lot with just the basics. And I think that's helped me come a long way.
Right on. Okay, so just for the listening audience, your official role with the Bears organization is?
So my title is Director of Rehabilitation Services. I'm a physical therapist, licensed PT, and my primary role is the rehab and recovery of the long-term injuries with the athletes and players that we have. So sometimes the lines will blur what's long-term and what's short-term. But usually guys who are out multiple weeks, season ending, those types of injuries, they're going to fall into my plate, and I spend the most time with them. But as anyone in the NFL knows, once you're in the season, training camp really rolling, you're all hands on deck with everything. So even though that falls as one of my primary responsibilities, I'm still doing a lot with the day to day and the week to week stuff, trying to get people through practices and to the games on Sunday.
Okay, so with the long-term injuries, I guess we'll jump in right there. You've got yourself an athletic training staff. You've got yourself a performance director slash strength coach and his or her assistants and so on. When you're talking about the long-term injured athlete, are you combining forces, or is it, hey, you're going to be working with me for a while, and then we're going to bring in the athletic trainer or the strength coach? Of course, you've got your nutritionist, you've got your mental skills or sports psychologist that are working with them in concert with what you're doing. But when it comes to the actual physical coaching of movement, are you the trifecta? Are you one handoff to the next? How does it work?
No, it's absolutely a team approach, top to bottom. We've been together for a while now, that whole team, performance team, medical team. So we all know what our strengths are, what our focuses are, what we have worked on in the past. And, we know who to go to if we either need help with something or in a different part of the rehab or the performance side of things. And we all can work together. And then we all want to make sure we know how to do those things ourselves as well, because at certain points, if someone is pulling a different direction or is doing something different, it's time for, let's say, a long-term guy to do a movement session or a lift. We want to know that we can have that covered, whether or not that's our specific role at that time. So we try to make sure that everyone can cover what's needed as necessary, but we also know what everyone really has their own specialty and role in here. But again, we try to make it as, team approach as possible. So at the end of the day, the players getting what they need on a day-to-day basis. We're not having to shift stuff down the road or move things around just because someone's not available at that specific moment when it's their time.
So I was gifted a very generous gift by some of the body coaches at Tom Brady's training facility about a year and a half ago. I went back to the Foxborough area, and their approach was really quite something, where they had the table over in a little treatment room with a farm door sliding back and forth that I could go out into their training facility. And we actually worked back and forth where they'd get me on the table, do a little soft tissue work, then put me out there, load into the tissue with a variety of different movements. They'd be like, okay, that's good. Let me tell you what, we're going to go back onto the table and do this and that. And I thought that was brilliant. I thought it was, okay, we're going to do manual and movement. We're going to unlock an area, and then we're going to integrate it, get some neuromuscular re-education going on there, see if these patterns are sticking, and are we loading into the right thing. I guess I'm a long-winded thing here, but is that something that I'm envisioning would be ideal for you and your either athletic trainer or strength coach, where, okay, I'm going to get you on the table, I'm going to work this area, and then hand off, I want you to go and do some lifts over there, and then come on back, we're going to work it. Do you ever find yourself doing that with your players, or is it, how does it work?
No, 100%. And I think the ideal situation is you're able to do that with everybody, because the timing and the order that you do different interventions in are going to help with your outcomes, both day to day, week to week, and down the road. So that's where the communication is key. And that's why we always talk, meet frequently, have side meetings, discussions. And if I know, hey, this order today is going to benefit this player most based on the schedule, I'll say this is the way we should try to map this out and make this work. Whether they start with me, get loosened up, go and do a lift, come back in, and then just do recovery with me, or if they come in, start with me, go lift, come back, and then they do some more isolated work or some more neuromuscular type work, before or after their fatigue, depending what the goal is, or anyone else on our staff, same type of deal. We try to set that up as best as we can so that the flow makes sense. So, it's not 5 o'clock, 6 o'clock in the evening, and they still have, maybe a heavy lift left or a lot of intense rehab exercises left, just because on the flow of the day and the need for recovery day to day, that just doesn't make sense. So I would agree. I think the ideal situation, you make that work for every player as best as you can, and not just the long-term guys, the short-term guys too, because they'll have those responsibilities to stay in shape and keep the rest of their body right while they're working on recovering from the injury that they're being treated for.
Right on. And when it comes to injuries that you're treating, lower extremity injuries are some of the most prevalent or most common injuries when we're talking NFL. So there's MCL sprain, there's meniscal tears, and there's ACL tears. And the interesting thing is that, well, ACL tears alone, looking at statistics, there were 52 ACL incidents in the last season, which is a 24% drop from the previous 2 seasons. So what's going on? What are you doing right? That's kind of my question. It's like, okay, why is there such an amazing drop in injury occurrence or incident rate, do you think?
Well, thank you. I'm glad you're asking me what I'm doing right, because I can't sit here and take responsibility for that, but I appreciate that sentiment. I think it's a complex question, to be honest with you. I'm a little bit removed from the research side of things, but my big thing has always been looking at data over time. So then I would say my goal is that we continue to see these numbers drop and see this as a consistent pattern. And I cannot honestly tell you what the numbers have been year to year off the top of my head, but that's a great thing to see. And now the next step would be, what can we continue to do to make sure the numbers continue to go that way?
So is it the emergence of sports science and GPS tracking and just more information that you're attributing this drop? Or is it that you and other teams and guys in your positions have developed different assessment tools or understanding of the movement or the mechanics behind it? I know it's complex, but you yourself, have you changed anything within the Bears organization over the last few years that might very well say, that might have something to do with it?
Yeah, and I think you hit the nail on the head. I can't say there's anything specific I can point to that has really led to that, to me or to our side personally. But what I can say is I think over the years that I've been in the NFL, I've noticed that people are starting to ask more questions now and seek out answers to those questions, which are leading us down the lines of looking at the sports science behind movement, load, volume management, all those types of things, and then different assessments along the way to make sure that when decisions are made during the return to play process, the rehab process, the reintegration process, that we have a lot of information now backing this, as opposed to potentially just feel, which I can say when I was a new clinician, a lot of times you did use feel, especially if you didn't have numbers behind you. You would just kind of go off of your foundation, know what you saw, do a couple tests, MMT, stuff like that. And you all know that has limitations, but that's what you had at your disposal. But now with all the new technology, the science out there, the experts out there, you have a lot of different tools you can use. And I think it all plays a part into it. But I really think it comes down to asking the right questions. Like if you're asking the question, why are we having so many ACL tears, or why are we having so many lower extremity tears in general? You start to find the answers, and the technology that's out there, there's so much of it, but that can help guide you towards the right technology to use. And then every club and team is going to be different. They're going to have their different principles, style of play, players. So everyone's going to have their own way that they're molding these athletes or trying to get them to be at their maximum performance level. So then you adapt that technology, the interventions, the testing to all of that as well. And I think it puts you in a pretty good spot. And I think the last couple of years, there's really been a focus on that. And that may be a big contributing factor to it.
Yeah, I could see more teams doing a lot of VBT and force plate readings to find out the rate of fatigue, and with that also, what their sleep patterns are like, to better understand how fatigued these players are and when to pull back in their training, when to push. So we're dialing in the training frequency and intensity and load with this information that you're gaining. But I'm also curious, has your approach to rehabilitating these injuries changed in regards to the tools you're using, the protocols, the frequencies, intensities, and so on? The volume that you're doing with them, has that changed over the last few years? I mean, 30 years ago, we could see ACL rehab involve leg extension, which these days you're not going to see that very much. And maybe it's having a comeback, but 5 years ago, a lot of people were just putting X's across that. There's too much shear force on the knee and blah, blah, blah. We got to get other things involved. But I'm curious, has your approach to rehabilitating changed very much in the last few years? And if so, what has changed?
It has, and I think the onset of some of the new testing and the different measures out there, and then the specifics behind that have helped. When I was really coming out of school, a lot of the big ones when it came to lower extremity and specifically the knee was some movement assessments, maybe the FMS, doing some isokinetic testing, some other things here and there. And you can get good information from that. But like you said, now with the onset of force plates, the different motion capture units that are out there, different isometric testing units that are out there, there's a lot of stuff you can do along the way and perhaps even more frequently that can give you information, because same injury, different player, you're going to have different things you're going to work on during the same time period. And some people will do well with one part of that rehab and others will not do well with that part of rehab. So that's where you start to diverge a little bit when you're coming up with your path and your plan for these guys. So if you're using some of these different tests and measures more frequently and they're more available, you might be able to pick these out a little bit earlier and then start working towards addressing that deficit earlier so that everything comes together nicer or more nicely in the end.
Yeah, I imagine if I asked you what your most important tools are in your toolbox, you're going to say your hands and your eyes. And if you don't, then I'm going to be really
I do
surprised.
that always, absolutely. Yep.
Yeah. I mean, your hands have so many nerve endings, and the amount of bodies that you've touched and everything else, you are very fine-tuned into the tactile feedback that you get. And of course, anything that you see, looking at bodies and how they move and joint articulations, all those things, I get it. So if we could just put those two tools off on the side and just accept that, yeah, this is the meats and potatoes of my work. What are the things that have come along, though, aside from that you're like, oh, okay, this is really important insight and information. I want to geek out a little bit more about this. Is it velocity-based training? Is it the force plates? Is it GPS? Is it blood flow restriction training? I mean, what is it? I'm sure there's a whole bunch, but what are the ones that percolate up to the surface?
Yeah, there is. But I would say if I pick out one just to talk about now, I probably would look at the GPS, because I think you can get a lot of information from that. And now there's pros
Like what?
that there's pros and cons to the different systems. But
Okay. What do you get out of the GPS?
So there's a couple of things, right? So you get objective feedback based on what the player is doing on the field when you use it, which I think is big. And then obviously you have other norms to what they may be typically doing before they were injured or when they were somewhere else. And you have comparisons to other players at their position. So there's a lot of information you can look at. And you also can really see, okay, what I did today, how does that compare to what they typically would do? Or what do they typically need to do? Or if this is someone that's going to be spending, a couple months on the field, a couple weeks on the field, what does session A look like compared to session F? What did it look like in between? Did I do too much early on, and now this is why I'm seeing what I'm seeing clinically? Did I not do enough early on, and now I need to try to make up for that? So you can really see in real time some of that feedback that you may or may not have had access to in the past, and really help kind of guide your decisions at that point with how you're going to move forward, how you're going to program everything, and what you're going to focus on. And then depending on the specific injury, let's say it's an ankle, and then what the specific player is and the position is, again, let's say it's an ankle, you're going to determine which parameters are most important for them based off of that. So if it's an ankle for an alignment, it might be a little bit different than an ankle for a skilled player. And it is different. So I'll just put that out there. It is different. There's different things you're going to look at and try to emphasize. So from there, you can get that feedback again right away. So you know that you're not getting caught trying to do the same thing with two very different players, even though they have the same injury, and they're getting what they need to from a stimulus standpoint when you're doing the field work with them.
Can you teach me that? I mean, can you explain? Like, okay, you've got two different players, and they are playing two different positions, and they are exhibiting the same injury to the foot ankle complex, right? You choose whatever you want, but how does that work for you in your mind?
Sure. So let's say you have like a standard GPS or like a local positioning system that you use. There are a lot of parameters that you can use with those systems, but a lot of the main ones are accelerations, decelerations, max speed, high speed yards, jog yards, change of direction. There's a lot of different things you can look at. But depending on the position that you play and then the specifics of that position and then what your norms are like, certain things may have more weight than others. So if you're a skill position player, you may look at decelerations when it comes to ankle and an ankle joint. And when you're looking at an ankle and an ankle joint of an offensive lineman, yes, obviously when you rehab them, they're going to need to be able to decelerate, but they're also going to need to be able to accelerate a lot out of a static position. So you may say, okay, I'm actually a little more worried about acceleration, so I'm looking at the data. And again, it really depends on the person. It really depends on the injury. But that's where you can kind of start fine tuning what the most important things are. Or max speed. Let's say it's a soft tissue injury of the lower body. You're obviously or maybe more concerned about the max speed and how long they hold the max speed and the high speed yards with a skill position player versus, an O lineman or a D lineman with the same type of injury, because they're not necessarily going to accumulate a lot of that during the, practice and the game situations. But it really depends on the specific player, the profile of the player, the injury history, and then what their demands are at their specific team, because it may be different elsewhere, and then what their role is.
Okay, so let's stay. That's great. I get where you're coming from now. We've got two players that have some type of subtalar issue going on, and one of them is going to be a wide receiver or tight end that's going to need to decelerate after acceleration, catch the ball, and then go. Meanwhile, you've got some O lineman who needs to really hit hard off the line. So I could see in a gym setting and in the strength kind of rehab strength perspective, I'm going to need to do some eccentric loading with my wide receiver and really work on that eccentric contraction. Where the linemen, we're going to go and really load concentric and maybe even isometric more so, just to give that. But what are you looking for? What's your athletic trainer and your physical therapy department in that regard, in that scenario? What are you thinking about?
So it goes back to relying on your eyes first and foremost. That's what I always go off of. That's usually my first test. Do they pass my eye test? If I'm taking them through some specific position drills, if I've mapped out a simulated practice session or a play drive, I'm looking to see how they're moving. I'm looking to see how they are, if it's an O lineman in their stance, how they're responding and reacting to different cues or cadences I might be given. But that's what I go off of first. And then I would use some of the GPS and the positioning devices to really see, is that registering at a threshold that's going to count towards what they typically do, or is it a little bit off from what my eyes are telling me, and I can compare that back to back. But in the back of your head, as you're watching and seeing the movement, seeing how they're generating force, how they're responding to it, how they're decelerating, how they're able to sustain the forces that they're doing, you're always thinking in your head, okay, well, what have I done previously to get them there? And then now do I need to polish this section off? Do we need to work a little bit more on power? Or no, maybe they're just saying they've still been a little bit stiff in that ankle. Maybe I just really need to get back and get them loose before they get out there, because they're losing power because they don't have the resiliency in their ankles right now. So that's what my mind is typically thinking about. Like, this is the product. This is what I'm trying to get close to saying, okay, hey, this person is ready. Is it matching up what I'm seeing with my eyes to what the objective feedback is? And then obviously what the player is saying. And if not, what might be that clinical reason why? And then how can I adjust what we're doing in these last late stages to make sure they get what they need?
Right on. Okay. And I think we can agree that there's an inverse relationship between mechanoreceptors and proprioceptors and injury, right? And so as a player is recovering from an injury, it would make tremendous sense to try and elicit good mechanoreceptor, proprioceptive responses, and not just in the rehab, and not just in the return to play, but also into the return to performance, that you're constantly, like you're saying, they're not getting the movement. Maybe there's some stiffness there. Well, with stiffness also comes a reduction of proprioception, right? So how do you, and the proprioceptors are what's going to fire up the tissue to control the movements, to decelerate and accelerate and so on. So I guess my question is, how do you encourage good proprioceptive feedback through the entire spectrum between rehab to the actual return to being on the field and game time?
I think it's being consistent with it across all the different levels. So starting early and then maintaining it throughout the rehab process. It's
How
incorporating.
often does that happen, though? That's kind of my question. Like, is that something that now in the last couple of years you're like, yeah, I got to get into that? That's obvious, or has it been going on for a while? I'm just curious because I don't see that necessarily happening in other organizations. They focus on it at first, throw a balance cushion or board or something underneath the person's ankle, have them do a couple other things, thinking that this is going to be all they need, and the next thing you know, we've got recurring injuries. So, what's that like?
Yeah, good question. And to be tough, I can't really speak across the board how often it's being used, but I can tell you it's a pretty big staple of what we do as a
Right
group
on.
here. We start as early as we can with it, and then eventually, if it's not, the goal of the day to really target that specific system, we still may use it as either like a warm up or like a pre-fatiguing stimulus, something just to kind of get them going a little bit. Because for the most part, my understanding and my approach to it is the more you can at least get that to fire a little bit, if not more, the better off they're going to be, because it becomes a motor memory type thing. And then when they catch themselves in situations where, you can't rehab to every single specific situation you're going to be, especially in football. It's so variable and so dependent on other people that that's impossible to do. But the more you can train the neuromuscular system to be ready for that variability, the better they're going to be to withstand a stimulus that they quote unquote may not have seen in a while or be ready for. And a lot of times the feedback you'll get from a player in that situation will be like, oh man, like I was out there, I was in the practice setting, I just got back and I hadn't really done that cut yet. Or I hadn't really done that cut and explosiveness yet, or had to react to someone yet, but I felt pretty good. And to me, that's telling me that as a team, we did a good job preparing the neuromuscular system to be ready for that, because you hadn't quote unquote done that exact movement to that point.
Right on, right on. And you also, Tristen, you mentioned resiliency. And I think that's a big component that is just now really being talked about more frequently, at least in my world of the podcast guests that I've had on. There's a lot of talk of resiliency, and with the NFL, the summer camps had been condensed, and I don't know if that was because of COVID or other things, but because of that, the players weren't building up a tremendous amount of resiliency preseason, and so we're starting to see a higher incident rate through the preseason and the beginning of the season. But last year was different. Last year, it seemed, and could it have been? I don't know about how long the preseason or the summer camps were, but I'm going to venture to say that I wouldn't be surprised if now you have a little bit more time to prepare the players before opening day. Is that the case?
And I think that's going back to what we talked about earlier, where the right questions are being asked. So when that data is being seen, it's being tracked, there are people out there noticing that, and they're saying, okay, well, why is this happening? What's the cause behind this? If there are many causes behind it, what can we address? And what can we do to try to, get that curve to dampen down a little bit? And again, across the board, it's going to be different. Every team's going to run their camp a little bit differently. Every team's going to run their preseason a little bit differently. But it really does start with asking those questions, and then you intervene while you can. And I think over the long run, that starts to make everyone just a little bit smarter, because they're learning from the experience. And then when you start to see if that product continues to improve what you like, then the intervention that you're doing is working, and you stick to it. And then you see how long you can make that last, and you either stay consistent with what you're doing, or then you make the changes on the back end if something goes a different way. But I really think that's what it comes down to, the stuff that they're doing to track and kind of see what's going on when these outliers pop up or these problem areas pop up. That's what helps guide the intervention and what needs to be done to help correct it.
Damn, Tristen, your answers are awesome. I love this. Okay, so yeah. Okay. So we've got two categories. We've got impact contact injuries, where their trauma occurs because of blunt force trauma, we'll say, whether it's ground or another player. Then you've got the non-contact injuries, which ACLs will often be the case there, MCL sprains potentially, but usually because somebody's falling on you. But on the non-contact injuries, it strikes me that this is more about improper movement patterns, uncontrolled force transference, or poorly managed force transference through the body, that there was a circuit breaker that just blew. So when it comes to the non-contact injuries, I'm imagining your approach overall and your hunting down of the clues for the underlying reason why this happened is probably going to be vastly different than the contact. So when it comes to the non-contact injuries, how do you approach that? How do you, because previously it was very symptom based, symptom centric. This happened, we're going to only focus on this area of the body where it's screaming. But what if it was force production through the entire integrated kinetic chain? Like, how do you hunt down the clues?
Yeah, and I think in the ideal world, I like to sit here and say I want to try to prevent everything, but obviously, as a realist, it's just not possible. And the collision ones obviously are tough, right? It's a violent sport. There's not much you're going to be able to do about it. It's going to
Right.
happen, and you can do your best. But at the end of the day, like we talked about, things being variable, it's just part of that game. But when it comes to the non-contact stuff, it's a great question. And it's again part of the field that's been evolving for a long time. I think the sports science and the movement devices they have out there are huge when it comes to that. Whether you use it as a screening tool, whether you use it as part of a weight room program, however you want to use it, I think using that stuff to help screen certain movements out are important. And then just developing individualized intervention based off of that. Again, sometimes, again, as a violent sport, stuff happens. You find yourself in a situation where you're coming downhill at a rate of speed that even you didn't know you could maybe be capable of. And then you try to change direction because that person on the other side is just as fast, if not as fast. And it's just too much for your body to handle. That happens, and it's unfortunate. And I wish I had an exact answer on how to stop it, but I think we're spending more time, and rightfully so, on trying to be proactive with this stuff rather than reactive. Because in my opinion, and I'm sure you would agree, it's kind of, I won't say easy, but hindsight 2020 after the fact to look back and say, hey, you know what? We did notice this in a movement assessment, or we did notice on this jump or in the weight room that he had some difficulty, controlling his knee movement with his hip and his core and everything, just to give an example out there. That's, the low hanging fruit to look back at. But are we picking up on these things early on and then intervening in real time to try to do what you can so when that moment comes, you're ready for it? Again, going back to that variability, when that moment comes that your body may not have been through yet, is it prepared to handle it? And what have you done to train for that moment? Because you won't be able to train for every single moment you're going to get into in the sport.
Yeah, I hear you. You mentioned the movement assessments, and earlier you mentioned FMS. So then there's the SFMA, which is more joint by joint. But I can see that out of all the knowledge you've been gaining over the years, it sounds like you've developed your own kind of criteria or movement assessment system. Is that right?
Yes, and I say it's pretty, I want to say basic because that almost gives it a negative connotation, but it's pretty foundational. Like I'll look at obviously squat movements, lunge movements, but you know, it's specific to the person, again, specific to the injury. And I use it along the way as opposed to set timetables, if that makes sense. And then I use it to help guide the intervention. Like one other thing I was going to say too, what I've at least noticed since I was working in college and now the NFL is just the evolution of certain exercises themselves. Like we talk about the core and the hip has gone from a lot of more isolated uniplanar movements to the full body movements, or focus on translating force through the core as opposed to just working the abdominals. And I think a lot of that stuff goes a long way. So understanding that concept in science is huge. But I think if you break it down to some of the more basic movements, you can catch some of that stuff early, which may not allow you to do that. And then you start bringing some more of that complex stuff into it. But from a rehab standpoint, a lot of times that's not too difficult because a lot of stuff is pretty basic early on, because you want to know, all right, can you do a body weight squat effectively, or can you do a loaded squat before I allow you to go back to squatting in the weight room? Can you do a lunge, or do I need to modify the lunge? So some really like basic stuff to look at. But then there's other times too where not research based or not literature stuff that I've seen or really read, but I know what you need to do as an O lineman or as a skill player. Let me just put you in that position, and you tell me, does that feel natural to you? No. Why does that not feel natural to you? What do you feel like is off? And they give you an answer, and then you can intervene from that standpoint. So not something that's standard to every person in that position group, but something that's standard and specific to that player. Because across the timeline of their playing career from youth up to this point, their bodies have also adapted in a way anatomically that allows them to do what they need to do. They may not be perfectly symmetrical, and they may not be able to become perfectly symmetrical, but perhaps trying to make them symmetrical could be a problem, because maybe they're good at what they're doing because they're not at this point. So there's a lot of things you have to look at. So at some point I try to make it super specific to that athlete and say, hey, get in the position you need to be in. Tell me what you feel. Are you feeling it in the joint or the limb we're trying to rehab, or are you feeling it elsewhere? And then it becomes my job to assess further and say, okay, why is this the case? Is it because you don't want to load that joint and you're compensating somewhere? Is it because you have a restriction? What really is that cause? And I don't know if you would necessarily pick all that up with some of the more foundational movements.
Yeah, makes complete sense. So I curious, your own uh, professional background and viewpoint when dealing with different positions on your squad. Is there one particular position that you find most challenging, and if so, why?
I think they're all challenging, to be honest, because
Yeah.
they're all different. Like every player has a different story, again, to the point to where they're at. All have their specific moves, all have their own specific training history, injury history. Every story, for lack of a better term, is unique to them, and each person is unique. So it starts with your approach, starts with your relationship with them. But I've noticed, I used to always say, like this injury or this joint is the most difficult for me to rehab. But looking back, that was earliest in my career before I had some experience. Now looking at it, I look at each one as being its own unique case, and I have to approach it almost like it's going to be the most difficult rehab I've had to do because there's so many variables that go into it. So I don't know if that's the answer you were looking for, but
Yeah.
that's typically how I tend to approach it and see that.
No, that makes complete sense. Okay, and then one other question I'm having right now is regarding concussions. It has been remarkable in this past one or two seasons with a 48 to 50% reduction in concussions. There were 422 evals across the league last season for concussions, which is a tremendous drop off. Some are attributing it to wearing the Guardian cap in preseason and practice. Um, and for those not familiar with the Guardian cap, it's basically a helmet, but instead of the hard shell on the outside, like the NFL helmets are, there's soft cushioning on the outside that's going to absorb impact. Do you, uh, do you see the Guardian cap actually taking more of a front row seat when it comes to game time? I know it's probably outside your wheelhouse or anything, but what's your opinion of the headwear, and is it making headway? No pun intended.
Yeah, no, it's tough to say. I honestly don't know about the game piece, but obviously it's gained a lot of momentum in the practice settings and being used different times of year in the NFL. And if I'm not mistaken, I want to say college may be using it a lot too. I'm assuming most are, but I think I've heard that. But it all obviously physiologically makes sense. But I think the other piece too to take into account is just that if you've never seen it, it's pretty obvious visually that you can see it. So it's a visual reminder that the players have that on for a reason too. So I think that has impacts as well, which may be understated when it comes to the information that's coming back. But it has been interesting to see how the data has responded to some of that, and I think it'll be even more to see how that continues to evolve over the next couple of years, and then where it ends up going.
So I've done a good deal of post-concussion syndrome work with the people that come through my facility and some of the teams that I volunteer with locally here, and being like high school football players and so on. And one of the things that I've found is there's an inhibition to impulse control when we're talking about athletes that have sustained concussions, which would promote more concussions because they don't have the ability to like, whoa, wait a minute, maybe I shouldn't go head first into this. So they have this inhibition to hold back. And then there's some other stuff that we work with like visual, not acuity, but just visual drills to try to get them back on track, and some visual drills too. When it comes to concussion rehab and returning them to the play field, what are some of the things that you're doing with your players?
Yeah, it's very complicated and complex. And we
Yeah.
talked earlier about every injury being unique to the person. Concussions 100% are unique to the person. And everyone, whether you've had one before or not, may act differently than the one before. So you can't even use, a history of how they handled something previously to go off of a current one. Whereas an ankle or something similar, you might be able to. So the NFL has a protocol, which has been great. It's awesome. The players understand it, and it helps us from the standpoint of really ensuring that when they are, ready to go back, or we feel like they're ready to go back, they checked every box that's necessary, and that they're ready to roll. But when it comes to different specifics, it really depends on how they're presenting. As you know, there's so many different symptoms that can come with a concussion, whether you can't sleep, difficulty focusing. You have to really then look at what you know or what you have in your proverbial toolbox to address that, and then implement it the best that you can. And then we have the team of the medical group outside of just us, the doctors and physicians are there to assist as well to really help with those challenging cases, because they really can be.
And going forward into this season, the 24-25 season, what do you find? You just said challenges. Everything's quite a challenge. What are your professional challenges coming down the pipe here, leading up to the next season?
I think it's just continuing to keep myself immersed in the new technologies, new programming, the new, performance stuff that's out there. Because year over year, a lot of times I've realized that colleges are getting a lot of exposure to new things. Players are coming in with routines, or players are being, treated or doing their own thing before they get here outside of different resources that either I'm not familiar with, haven't been around. And these players are coming in faster, stronger, even more so than previous years. So to me, I feel like it's my responsibility and a challenge to always stay up to date on that, so that when that player comes in and they need something, I can either one, be able to address it in a way that I know how to and take care of that for them, or if it's a skill I don't have or something I'm not familiar with, be able to facilitate or point them in the right direction, and not just kind of, brush off to the side because it's not something that, I'm either used to or I've heard of before. Because there are a lot of different ways to approach different things. And if something helps someone and I don't necessarily agree with using it, or I don't see research behind it, but it helps you, who am I to say, yeah, stop doing that or don't use that? It's my job to be able to understand it more and see why it might be helping you, and then take that and see if it could help somebody else down the road. So that's what I try to challenge myself mostly year over year, to trying to stay on top of all that, especially with how much is out there. Sometimes you can get lost trying to go down the rabbit hole and see what there is. But as I let the players guide that a lot, I'll talk to them. I'll ask what they've been doing at the university, especially the rookies, or if guys came from other teams, ask, what were you doing there? How did they work on this? Or what works for you? And then try to adapt that or learn more about it if it's not something that I'm used to.
Yeah. Okay. So where in this rabbit warren are you currently? Where are your eyes looking in the next, say, this next month, as you're trying to gain more insight in education?
I think I'm trying to just continue to develop my understanding and ability to apply the sports science aspect to my return to play. We talked about the GPS earlier, but looking at the interplay between external load and internal load, what exactly that can tell us, where there's different variables that I can measure or start doing some things earlier that might have effects later to benefit guys down the road, and then really try to merge conditioning with rehab, so that when someone who's been out with an injury is cleared medically, have I been able to implement enough safely to the point that I'm not aggravating or hurting them from an injury standpoint, but conditioning wise, they're somewhat protected to get back and be reintegrated, so then they're not set up for failure because they're fatigued. So finding that balance between the two is one thing I continue to challenge myself with. And I think we've gotten a lot better with that, but it's something I think we need to continue to work on, because there are different levels to, obviously clearance and return to play. It's not a very black and white answer a lot of the time.
Okay, cool. This last question's kind of off the cuff here. I was just back in Chicago last month at a conference presenting there, and not only was it freaking freezing outside, but I decided to take the architectural riverboat tour, and then I went to the Art Institute. But somewhere along the way, I stopped and grabbed myself a slice of pizza. So, what are your favorite Chicago foods? Seeing that you've been there for a few years, you've figured it out. What do you like in Chicago?
So I'm not a huge deep dish guy. So being from Pennsylvania, obviously I'm more of a New York style. People give me crap all the time because they ask me what my favorite pizza is around here, and I say Papa John's. They think I'm crazy, but I subscribe to that.
Thin and crispy, right?
Consistent. I know what I'm
I
getting.
get you.
I don't got to be disappointed. The last thing I want is to order a pizza and be disappointed with what I got. So
yeah, I don't need a fork and knife to eat my pizza. So right. I get you. Okay. Where do you go do you ever go anywhere for a Chicago dog? Do you get a hot dog anywhere?
I'm not a big hot dog person, to be honest with you. Never really have been. So I don't have a good answer on that. Like,
all right, then what's your go-to food in Chicago?
So I'm a big burger guy, huge burger guy. So there's this restaurant. It's like a smaller hole in the wall place where I live, a little north of the city, far north of the city, north of our facility. It's called Emil's, and I would say it's an upscale diner, but to me, the food is incredible. And I'm probably there with my wife and kids maybe twice a month, if not ordering out more than that, because it's consistent, it's good, it's fast, which is huge when you have kids. Like, they need their food faster than appetizers and drinks arrive. So that's important too. But that's probably the one. Whenever people are in town, that's usually where we go. And it's got a good, nice little like low key bar scene. It almost reminds me of the Pittsburgh feel. Like I said, I went to undergrad at Pitt, so I'm used to going in, having good food, cheaper food, nice little bar area, and all that. So it brings me back to that.
Right on. Okay, I'm gonna have to visit Emil's the next time I'm back in town. Yeah, Tristen, this has been fabulous. I honestly, we just covered so many things on my list of questions, and you just hammered right on back in a perfect style. I can't thank you enough for coming on and sharing this. And honestly, with this upcoming season, being a Patriots fan myself, and you being in the Bears organization, I can only think that we're going to have a better season than we did last year.
That's absolutely. That's how you have to approach every season. That's the number one mindset right there. I love it.
Man, that was a good episode. I want to thank Tristen for coming on, as well as Chicago Bears organization for allowing this to happen. And do check out Setanta College. It is a fantastic organization that is getting a lot of my guests to go through their programs for their Masters of Science. So check out setantacollege.com. Remember, if you want a little bit off the tuition, just hit RS10 and the coupon code setantacollege.com. In the meantime, check out a few things on my website, rockysnyder.com, and we'll see you next week.